My name is Dr. Ahmed Kamara, Clinical Director of Doctor to You and the UK National Health Service NHS GP, sharing useful medical knowledge with you so that you can become masters of your own health. It is important to remember that nothing shared here is a direction on how to manage your particular health condition. You need to always seek expert medical advice for your personal circumstance. Today, what I would like to talk to you about is gastro-oesophageal reflux, commonly known as acid reflux disease or indigestion. So, what is acid reflux? Well, acid reflux is basically when acid made within the stomach regurgitates or comes back upwards into your esophagus or your food pipe, and it causes an irritation in your food pipe that causes a burning sensation or discomfort or sometimes pain. Now, when you present to your physician, they may refer to acid reflux or your symptoms as dyspepsia, and that is because acid reflux is part of a constellation of other symptoms that collectively are known as dyspepsia. So that is the acid reflux itself. Now, some people may experience pain in their sort of upper abdominal region. Some people may actually get nausea or vomiting in association with any of these symptoms, and collectively it's known as dyspepsia. Well, how common is acid reflux? It is actually very, very common. 40% of the population are estimated to be affected by acid reflux, and in the UK alone, about 5% of the population presents with their GP every year in relation to acid reflux. And a further 1% of those need referral onwards for specialist investigations. So it is quite a common condition that many of you watching this would have had, and many of you watching this would have managed yourself without actually visiting your GP. What are the risk factors for acid reflux? Well, you can develop acid reflux without any of the items that I'm going to state here. However, if you smoke, or if you have a lot of spicy food, or if you eat late at night, uh, your risk of developing acid reflux are high. Now, if you're also overweight, or if if a woman is pregnant, and especially towards the latter stages of pregnancy because of the pressure on the stomach, that can also increase your risk of acid reflux. Now, taking certain medications such as ibuprofen or Nurofen or aspirin, collectively known as non-steroidal anti-inflammatory drugs, again, that can also increase your risk of acid reflux. What symptoms might you have if you have acid reflux? Well, it varies for different people. For some people, as I mentioned earlier, they may actually get a burning sensation as the acid regurgitates up their food pipe. For others, it may be a chest discomfort or frank chest pain, usually at rest. Other people may actually get the taste of acid at the back of their throat. Importantly, at the moment, in the context of the coronavirus pandemic, acid reflux is also one of those causes of cough. So if the acid regurgitates right up and then trickles into your windpipe, hitting your vocal cord, it can cause a cough. And it's a cause of chronic cough in some patients. Now, for some patients, they may also get pain in the upper abdominal region. Now, there are some particular symptoms that worry us as doctors as to whether there is more sinister cause for your symptoms. So if, for example, you vomit blood, or you actually have difficulty swallowing, or you're losing weight, now these are causes of concern, and certainly if you have any of these in association with your acid reflux symptoms, you should seek urgent medical advice. Now, are there any particular tests for acid reflux? Well, to be frank, often the diagnosis is made from taking a careful history from the patient, uh, and that would usually determine that what you're experiencing is acid reflux, and a course of treatment can be initiated. However, sometimes it may not be so clear, or perhaps we've initiated some treatment courses, or you've done some self-help measures such as stopping smoking, you stopped eating late at night, you've lost some weight, or you've taken some over-the-counter anti-acid medications like Gaviscon, and you're still experiencing symptoms. Now, these may be cause for further investigations. Now, the investigation is to actually find out whether there is anything else going on, or whether there is an underlying condition that's making your acid reflux resistant to treatment. One of the causes is ulcers within the stomach, or an inflammation within the actual food pipe itself. One of the tests that's done is to look for bacteria called Helicobacter pylori, and this can often be done in the community through a stool test, where the antigen, which is a recognizable marker of the bacteria, is detected within the stool. If found, you can then be given the appropriate treatment, which is often a combination of antibiotics and medication to reduce the amount of acid your stomach produces. This test can also be done through a breath test, but that's often done in hospital. Now, it may sometimes be necessary for you to go ahead and have an endoscopy test. And the endoscopy test, also called a gastroscopy, is actually done to directly visualize the lining of your food pipe, your stomach, and the first part of your small intestine. It's done using a tube smaller than your small finger. That depends on how small your small finger is, of course, but it's about that size, with a camera at the end of the tube. And under sort of skillful expert, they can visualize the lining of your food pipe, your stomach, and the first part of your small intestine to determine whether you have any ulcerations, or indeed any other cause of your acid reflux. Now, when you see your physician or your GP, often they will be asking you questions and examining you to determine whether your chest discomfort or chest pain isn't because of an alternative cause. Of course, heart disease can cause chest pain, but also some intestinal diseases, so a gallbladder abnormality, can cause symptoms that can be reminiscent of acid reflux, and so it is really important that if you have acid reflux that's not responding to over-the-counter measures or self-help measures, that you seek advice to get a more accurate diagnosis made, so that you can get the best treatment. Now, talking about treatment, I mentioned some of these before, but let's go through them again in detail. There are a lot of things that you can do yourself, and a lot of you watching this would have done this or spoken to your GP or physician about this. If you have acid reflux, it's really important that you avoid having spicy food, you avoid eating late at night, you avoid smoking, or you stop smoking if you are a smoker. Also, that you significantly reduce your alcohol intake, as well as losing weight, because these are all risk factors for acid reflux, so that makes the treatment very difficult. Now, beyond that, you can also buy over-the-counter anti-acid medications like Gaviscon, which can help reduce the amount of acid in your stomach. Now, if those measures haven't worked and your physician has done further tests, and they feel there is nothing else sort of sinister on the line, then you may be prescribed a course of a medication that reduces the amount of acid in your stomach. Now, these are called proton pump inhibitors. I won't go through the actual names of these, That's just the family name or the group of medications that they are. And then you have others that are called H2 antagonists as well. Well, these are things that your physician will go through with you. Now, of course, if an alternate cause is found, then they will treat that accordingly as well. For example, I mentioned earlier, some people may have a bacteria called Helicobacter pylori. Now, this may warrant a treatment that involves a combination of antibiotics and medication to reduce the amount of acid your stomach produces. Again, for some people, they have a laxity. They have a laxity at the junction between the food pipe and the stomach called hiatus hernia. So normally there should be a tight sort of junction where the food pipe enters the stomach. But if that's lax, then acid just comes up very easily. And that may be because someone has something called a hiatus hernia. When this is the case and the medications haven't worked, it may sometimes be necessary to go ahead and have an operation called a fundoplication operation, which can be done by keyhole surgery. So you may hear it being referred to as laparoscopic fundoplication, to tighten that connection between the food pipe and the stomach, and hence reducing the amount of acid coming back up. So what are the long-term prognoses of having acid reflux? Well, if all you have is acid reflux without any other sort of worrying underlying cause, so for example, they haven't found a mass causing a narrowing of your food pipe, or you don't have any actual stomach ulcers, or you don't have severe inflammation of your gullet, then acid reflux itself can be annoying, but it's not a threat to your life. Okay. But it's a very annoying symptom to have, and so it's important to follow the advice that I've mentioned above. There are a lot of things that you can do yourself without necessarily having prescribed medication to help manage your acid reflux symptoms. So look, I hope today has been really helpful for you discussing acid reflux and some of the other potential worrying underlying causes. The key here is there is a lot that you can do for yourself to help your acid reflux symptoms, but it's also really important that if those measures are not working, that you seek expert medical advice to determine the right management plan in your particular circumstance. So my friends, that's all I have time for today. I hope it's been really useful discussing acid reflux, and that you've gained some snippets of information that will help you in your journey towards becoming masters of your own health. Remember, if you have any symptoms of concern, it's important that you seek expert medical advice. You can do that through your GP or your physician. But of course, if you want to reach out to us at Dr. To You, you can contact us at through our website at www.drtoyou, that's drtoyou.co.uk, or follow any of the information that you see on the screen. I look forward to seeing you next time, when we should be discussing another interesting medical condition.